Hi, I'm Dr. Rachel Tate, coming to you live from Rheumatology Winter Clinical Symposium 2017 in beautiful Maui, Hawaii, and I'm here representing RheumNow.com. So I wanted to introduce you to somebody that I just met who's really influential and is coming up in the world in rheumatology, which is Dr. Zainab Hassan out of Arizona. Zainab, what brought you to Rheumatology Winter Clinical Symposium, and what is this beautiful poster I have behind me?
Thank you so much. So my patient is 62-year-old female that have been admitted to the hospital for ongoing left wrist pain and swelling. She have been 8 months before admission. She have operation for her CMC osteoarthritis. She had trapeziostomy with mini tight rope suspension and arthroplasty. 1 week after the operation, and this is an easy operation, she got pain into that side, and then this progressed to pain on all her wrist. She have 2 explorative surgery to see if there is an infection because of the MRI finding, and there is edema into the bone marrow that progressed into the last MRI, and the 2 operations didn't show any kind of infection, and even her inflammatory markers was normal. She have normal CBC and comprehensive metabolic panel. She do not have any systemic symptoms. We did evaluate her only into the second admission, and at that time there is no evidence of any connective tissue disorder or systemic arthritis. There is no evidence of infection, and we don't have any of these labs. Then after discharge from the hospital, we find that her ACPA is positive and her rheumatoid factor is negative. But the most interesting part is her pathology, the synovial biopsy, which show this finger projection, which show mostly inflammation and hypertrophy. It show also lymphocyte and the plasma cell infiltrate and lymphoid follicle. And there is no neutrophilic inflammation and no evidence of infection even by staining or evidence of crystal. So it was a case of rheumatoid arthritis, and the diagnosis was very early, so we initiated the treatment very early, and she ended up with complete remission because we find this patient very early. So it is important to start synovial biopsy on diagnosis of monoarthritis and oligoarthritis as in our patient, and the diagnosis at the beginning was infection, whether into the synovium or into other area of the postoperative period.
Dr. Hassan, thank you so much for reminding us that it's very important to consider monoarticular arthritis options, including early rheumatoid arthritis. So thank you again for coming today, and again, check us out on RheumNow.com, and aloha!